I'm an educator and board member of the Arizona branch of the International Dyslexia Association. I am honored to be with you all today, hosting this important chat on dyslexia and anxiety. Our guest speaker today is Dr. Laura Wingers, who I look forward to introducing you to in a moment. But first, let's go over some quick housekeeping items and our coffee chat agenda. So we're using the Zoom webinar platform today. It's different from the Zoom conference call. So you are only seeing the view feature. You can only see us and you can't see all of the attendees' videos. At the bottom of your screen is a Q&A feature that we're going to be using later in the chat. So the chat is going to begin with Dr. Wingers giving her presentation on reframing anxious behavior for children with dyslexia. Then we're going to go into our Q&A, and then we're going to do a wrap up with some prizes and great giveaways for our Arizona residents. So as an educator, I'm seeing students struggle with anxiety more than ever before. And research shows that as many as 20% of children with dyslexia also suffer from depression, and another 20% suffer from an anxiety disorder. There is a definite need for strategies to help our dyslexic students and children deal with stress and anxiety. One person who has been instrumental in supporting many of the dyslexic students and families I work with is Dr. Laura Wingers. Laura Wingers is a clinical psychologist and the founder of Center Psychology and Consulting, located in Scottsdale, Arizona. With a background in pediatric neuropsychology, clinical psychology, and school psychology spanning nearly 20 years, her current professional focus includes early childhood development, gifted intellect, developmental asynchrony and twice exceptionality, dyslexia, dysgraphia, dyscalculia, and other learning differences, ADHD and executive function impairments, and anxiety and mood disorders. She is particularly passionate about identifying and meeting the needs of children in the early years and working with children who have developmental, social, and behavioral needs along with their families. Dr. Wingers works closely with parents, teachers, physicians, and other treatment providers, and she advocates for an integrative approach in the implementation of treatment recommendations. We are pleased to have Dr. Wingers with us here this morning to discuss ways to reframe a child's anxious behavior using a strengths-based approach that promotes happiness and well-being. Let's all raise our coffee cups this morning and give Dr. Wingers a warm welcome.
Thank you all so much. I am thrilled to be here with you. I'm going to share my screen and let's jump right in. As we think about all of what's going on right now, this was such a great opportunity for me to reflect on what this year has been like for all of us. It really occurs to me that every single person I know has been dramatically affected by what's happening in our world today, number one. And it just raises the alarm more than ever for the need for strategies that support well-being. When we think about kids with dyslexia, which is a topic really near and dear to my heart, with having a number of family members with dyslexia and seeing the impact of that on them, it really occurs to me that they face some double challenges sometimes. And so I really hope that this talk will be useful to you, whether you're a parent or an educator or in another role with children with dyslexia, in thinking differently about behaviors you see, and maybe having some additional strategies in your toolbox as far as how to support these kids. Like all of you, I really wish we were in person, right? Zoom fatigue is a real thing. So my need to connect with you in person is strong, but I do hope that this coffee chat will be a great opportunity for us to just share what's happening. It occurs to me to ask, and maybe there's a way for you to comment in the Q&A, what's your stress level like? What's your stress level like right now? If you had to rate it on a scale of 1 to 10, with 1 being very little or minimal, day-to-day stress, and 10 being, I am really kind of at wit's end. I'd be curious to see what people are saying about that, because it's been my experience that people are having a lot of different challenges right now.
Yeah.
So when I think about this image really spoke to me, right? Where just sometimes people will tell me, I just feel like I'm hanging on by a thread. I'm working really hard to keep it together. I've got all these challenges just in my own daily life, whether it's work or childcare, parenting challenges, schooling, all of that. There's a lot going on. And of course, there's a lot going on in our world right now as well. So let's just start by taking a collective deep breath, right? Right? And recognizing that we're in a difficult time. I want to talk about this with all of you. And again, I'm looking forward to our Q&A, but this is from Aubrey Hirsch and on Vox.com, and she's written a really clever little cartoon about, you know, the hell that is remote schooling and parenting, and talks about, you know, the need to vent, and it's both awful and helpful to see so many parents chiming in with this common refrain. This is not okay. I hear you. It's a nightmare. Everyone's in my house is crying. Maybe that's not the case in your situation, but it certainly, I think it speaks to this collective need to connect and to say, hey, we're not okay. There's a lot going on right now, and we need some support. So let's talk a bit about what this means for children with dyslexia. We talk about the fact that children with dyslexia may experience anxiety, as you talked about the statistics there. So why, right? Why is that? Well, number one, you know, let's talk about the fact that we are living in a global pandemic. There are some significant changes in-person schooling and online schooling, and the supports available to children who learn differently, right? I think that's been a challenge that if you're an educator out there, you're facing that frustration. It's exhausting. It's hard to connect. It's hard to give children the supports that we would normally give. Children with anxiety who also experience dyslexia, there may be other sources as well. So quite often I'll see someone referred to me for the concern is about anxiety. And in fact, there is an undiagnosed learning difference like dyslexia or dysgraphia or dyscalculia. And we'll talk about some strategies for addressing that. But certainly you'd be anxious too, right? If you were faced with a challenge, feeling you couldn't do something well, not having that well understood. Attention deficit and executive function challenges are another source of anxiety for children with dyslexia. I think when we are online schooling in particular, and you've got to go to many different tabs and many different resources and track all of these things, that can be challenging for anybody. But certainly if you've got some attention or executive function difficulties and you're kind of tied to this screen for much of your day, that's really challenging as well. We have to talk about the fact that for some families, there is a predisposition to anxiety. Maybe there's already an existing anxiety issue, and certainly things that are happening now are amplifying that. Other factors that I see for children with dyslexia who may be experiencing anxiety: imbalance in screen time, their social media usage. Raise your hand virtually if your child is getting way more screen time than what your typical, you know, levels were. I think that's true for a lot of families. Along with that, because of all these changes that we're experiencing, kids are having really irregular sleep levels, or not getting as much exercise and outdoor time as they were. Maybe their diet has changed. And we know that those are factors that really do influence mood and behavior. Trauma is another factor in the experience of anxiety. We have some children living in unsafe environments, or living in environments where they're not supported, or maybe they're supported, but there's a lot of stressors outside of the home that are impacting the family, right? We see an increase in domestic violence We see an increase in just conflict in the home. And so again, depending on the child's experience of that, we are also going to have some symptoms of anxiety. Many other children are telling me that they're feeling isolated. They're not seeing their peers. They're not seeing their friends. They're feeling disconnected from their school. They're doubting their abilities. Now, we know this is a very common issue for children with dyslexia when that issue is not well understood or they've not yet gotten the intervention and support that they need, right? The child just says, I'm stupid, I can't do this, and just wants to kind of give up and feels overwhelmed. So these are all very real, factors when we think about anxiety for children with dyslexia. So can we first talk about the fact that feelings of anxiety are normal, right? Let's normalize this experience as much as we can. Everyone experiences worry or anxiety, and anxiety can be expressed in many different ways. So I break it down typically into physical or physiological sensations, things like muscles are tense or getting a headache, stomach ache. For some folks, it's a rapid heart rate. Maybe they're getting sweaty palms or dry mouth. Kids will often have a general I don't feel well kind of complaint about anxiety. Thoughts and feelings. It's really important to examine that. Are you worrying excessively? Are the thoughts self-defeating in nature? Some folks are very hyper-vigilant, meaning they're constantly scanning for danger, predicting the worst. Having trouble concentrating, feeling sad or moody, withdrawing. Some folks will be overly jokey as a compensatory mechanism, right? They're going to kind of put off that feeling of anxiety with that. And then behaviors that go along with anxiety, I think, are important to recognize as well. Some folks might have trouble sleeping. They may avoid. They may be irritable. And I think that's one thing that we often see in children with dyslexia, where there's behaviors that are difficult. So they're avoidant, they're maybe oppositional, and it's easy to just look at the surface of that and treat it as oppositional behavior. But in fact, we really have to look at some underlying issues there. What is this really about? And very often it's anxiety. And if we can speak to the anxiety, if we can speak to the underlying feeling, all of that resistance dissipates, right? They're feeling heard, they're feeling understood, they're feeling that someone's connecting with them, and they're feeling supported. And so that feeling of anxiety can quickly resolve. That defiant, avoidant, oppositional stuff can quickly resolve. So that's really the aim of today too, is let's better understand some of the things that we're seeing with the children in our care, whether you're an educator or a parent. So I'd like you to start by doing a reflective exercise, if you would. I want you to really get curious, and we're going to talk about mindfulness in a few minutes. Getting curious, observing without judgment is a big part of what mindfulness is all about. And so I want you to close your eyes, and I want you to think about the child or the person in your life that you're most concerned about when it comes to this concept of anxiety. I'd like you to put yourself in their shoes and spend a day in their life. Start by what happens when that child wakes up in the morning. What do they have to look forward to in their day? Who's there with them? What is that morning time like? What happens when they transition to school? Who's around them? Who connects with them? What supports do they have in understanding and digesting the material that they are exposed to? On to lunch, on to the afternoon. What happens after school hours? How are they spending their time? Who are they with? What might they be experiencing? The evening, same questions. Who are they with? What are they doing? What's around them? Right? So I hope that perhaps leads you to a deeper reflection when you have some more time later to think about, okay, what does this tell me? What did I learn from that experience? If we were in person, we'd have a pretty rich discussion about that, but I look forward to some comments in the Q&A section about what aha moment perhaps you had as you think about the child in your life that you're concerned about. Other things I want to be sure we talk about are we sure it's anxiety? Right? Are we sure that this is truly anxiety, or as I said before, perhaps an underlying issue that hasn't been addressed? So if it's misunderstood, if it's misdiagnosed or mistreated, the pattern of anxiety is in fact strengthened and it can be reinforced. So do we truly have a clinical diagnosis here? Is there something like an attention or executive function issue? Is there a true anxiety disorder? Is there an autism spectrum issue? Dyslexia or other learning differences, so on and so forth. Is that what we're dealing with? Or are these perhaps expected behaviors and maybe better understood and managed as the child being perhaps out of sync in one or more areas of development or in one or more areas of their life? I also want to be sure that I emphasize, know when to get professional help. When do we take action on this? Well, we certainly want to do this before it significantly interferes with functioning at home, at school, in relationships, or in just internal or personal distress, whether that's for you, yourself as the caregiver, or whether that's for your child. Really, think about that. We certainly want to take action before this makes children's lives harder than they should be, or limits the experiences they have. I often say in this time of difficulty, are you growing into more or are you retreating into less? And I think it's an important question to ask of yourself and your child. Anytime these feelings are unwanted, they're out of proportion, they seem uncontrollable, and they're not going away, certainly that's a time to take action as well. And, I would be remiss if I didn't also mention that if you have a child who's self-injurious or suicidal, you need to seek help immediately. And that means going to your emergency room or calling the EMPACT, E-M-P-A-C-T, EMPACT crisis line. Okay. So with this caveat, let's talk about what works best. I guess just like with our coffee, everybody takes it a little different, right? So I think it's important for us to recognize that there are many, many strategies out there that assist kids and adults in dealing with anxiety. We'll talk about some more specific examples as we get into the Q&A, but I do want to give you an overview of a couple of different things that I think are really important for us to recognize. First off, remember to focus on what matters. Let go of what doesn't. Really, the whole don't sweat the small stuff is very, very real right now, and we really need to focus on what matters. And when you think about that, what really matters is connection and support with one another, right? That's what your kids will remember when all of this is through. When you're dealing with a difficult situation in your family's life, I think it's important to just communicate the sense that, you know what, we may not have all the answers, but we're in this together. We'll figure it out together. Remember, and this is the psychologist in me coming out, all behavior has a function. When children are anxious, they often express poor self-regulation and these negative thinking cycles that they can't seem to stop, right? They're inflexible in their thinking. Sometimes they'll seem unempathetic, as though they don't care. When they're calm, they can express that skill, but when they're anxious, they cannot. All behavior has a function. And for children with anxiety, sometimes negative attention is easier to get and it's easier to understand. So we'll talk about some other tips around that later on. I want to bring up a couple of things that, particularly in the school environment or around schooling, we find are very predictable anxiety triggers. Unstructured time, transitions, writing time, let's address that one, and unexpected change. Those are very predictable anxiety triggers. And some antecedents to negative behavior, some of the things that might happen before you see that avoidant, resistant, anxious, oppositional behavior come out, are in a situation where their engagement with another child, their social interaction is unfacilitated. Now, when we were in person, or when we're in person, we think of that as engagement on the playground or the lunchroom. Online, it's the nobody's watching what I'm doing while I'm online, and what am I getting into. Maybe it's being asked to wait. Maybe it's being told no. There's writing again and transitions again, right? So these are very predictable anxiety triggers and antecedents to some of the negative behaviors that might come out in children in the school setting. I want to talk about some of these tricks and tips that help make it work from schooling at home. I want to talk about some tips for teachers. I want to talk about, how do we model new skills and show children that we're in it together, help them process what they're experiencing. How do we combat what I call stinking thinking, these thinking errors that we often make when we're anxious? So I'll come back to all of this. I want to talk more about mindfulness, and again, how are we making meaning of what's happening for us right now? And again, just recognize the importance of support and community and connection in all of this. So with that, I think, Heather, I'd like to jump into some Q&A and just see what reactions or questions we have as we start this process.
Okay, perfect. Thank you, Dr. Wingers. We had some questions that were submitted prior or before the chat began. So I'd like to give you one. I'd like to give you one of those questions, and then while we're talking through the question, everybody, all our attendees, if you have a question for Dr. Wingers, go ahead and type it in your Q&A, and then I will fill them out to Dr. Wingers. But the first one of the questions that came up that I think a lot of us that work with dyslexic kids have seen, and parents of dyslexic kids. Here's the question. During homework sessions, my son might make a mistake and say, "I'm stupid. Can you give me some suggestions for addressing this? And do you have thoughts on addressing it in the moment versus staying task focused and then addressing it later?"
Oh, what an excellent question. And yes, I see this all the time. It comes to mind as I was just working with a little one not long ago who was hitting himself in the head when he was feeling that experience. He's having a frustrating time with schoolwork. So yes, that is an important one. I think the automatic knee-jerk reaction of that is we want to say, "No, you're not stupid. You're so smart." And, we want to reassure, we want to support them. But I think sometimes that has the opposite effect. If we overly reassure a child who's anxious, who's self-doubting, if we overly reassure them, we're in fact telling them, "Oh, actually, there is something to be concerned about here." Right? So we want to be supportive, we want to be empathic, and we also want to move them through that intense feeling they're having in that moment and reframe what's going on for them, reframe. So I'm going to actually jump back to a couple of the other slides that I had, because it goes right along with that. So I think number one, stinking thinking is an important one for us to recognize. I'm stupid. So I made a mistake. I spelled something wrong. I didn't follow the instructions. I made some mistake, and I went from this specific situation to this globalization of means I'm stupid, right? So we want to do a couple of things there. We want to, number one, acknowledge the feeling that's underlying the words. It is less about the fact that this child says they're stupid and more about the fact that they're feeling frustrated. isn't it? Don't you find that, Heather?
Yes, absolutely.
I find it to be, and so just being warm and empathic, sounds like you're really frustrated, huh? And just leaving that, letting that sit for a second.
Right.
I'm not acknowledging the stupid, that thought, I'm acknowledging the feeling. You sound like you're pretty frustrated, huh? Gosh, right? And then quickly reframing from, remaining task oriented, as the person who's asking suggests, of let's get through this together. There's that message again. Together we can figure this out. Let's back up and let's start over, right? So in that moment, it can be something as simple as that reframe. And I hope that's helpful.
That is helpful. Thank you. Let's see if we have any more questions out there.
Mm-hmm.
Let's see. So let's see. We have no questions, but I have questions for you, Dr. Winger.
Yeah, please.
So I've had, when I work with some of my students, I've had tears, and just then I've seen out of control behavior too. So do you have any tips for in the classroom when emotions, become apparent?
Yes. Yes.
And then the kid is just more anxious because they're, crying, or they can become defiant as well. And you had mentioned that earlier.
Right. Yeah. My tip there is when they go high, meaning their emotions or their behavior heightens, you go low. So you're going to get more still. You're maybe going to lower your voice. You're going to get calmer, right? Because I think what we're doing in that moment is, we're not just expecting the child to self-regulate, we're really needing to co-regulate, meaning that we're impacting each other. When you see, as a teacher, when you see that child becoming that frustrated, tears are starting, or they're starting to boil over, you feel something.
Yeah.
Right? You feel something. And so you've got to, first of all, check what you're feeling, and then recognize that this is an opportunity for us to connect. When we can connect, then we can redirect. So whatever that might look like, it depends on the child, it depends on the age. I think there's so many other factors that impact that. But it really is just I see what's happening here. Let's take a little breather. And this is where things that I'd like to talk about, some of these other tips. Some of this is doing the work ahead of time so that we're not just faced in that moment. I love the experience of mindfulness and teaching mindfulness to children. I think that can be such an important piece. So there's opportunity for mindfulness through a number of different programs out there if you're interested. But let's first talk about what that is. Mindfulness is just paying attention in the moment without judgment, right? With just acceptance. And it's a practice. It is something that needs to occur over time. So do not expect children to engage in mindfulness practices unless you yourself are using these as well. So I think it's important for us to, and we can just kind of do this as a group right now, if you don't mind. Just start by getting still and quiet. Maybe instead of looking at the screen, close your eyes or look away. Notice your breathing. Notice any sensations in your body. Maybe you're feeling a little tension in your neck or your shoulders. Maybe you need to just uncross your legs and get settled and smooth. Taking that deep breath. And now I'll ask you to come back for a moment to us. Whether you're aware of it or not, you subtly recalculated something in your body. You changed your breathing, you changed your musculature, something happened there just in that very brief, that was what, less than 30 seconds that we did something like that. Stopping, taking a breath can be so important. What I really love for kids, though, is engaging these as a part of the daily routine, whether that's a part of the daily routine in the classroom or it's something that you're doing at home. Now, you might say, oh my goodness, there's no way my child is going to sit still for mindfulness practices. Totally get it. And I have taught mindfulness practices to children as young as 4 and all the way through the high school and early adult age, of course. So it's different at different ages. Really, again, what's the essence of mindfulness? Paying attention in the moment to what's happening without judging it. Because your body wants to kind of return to equilibrium. And if you stop long enough to just take that breath, check in with yourself, often you'll do it, on your own. And the same is true for children. So with children, we often begin with attention just to the external environment, particularly with little ones. It's like, let's just get really still and just really look all around the room. What do we see? What do we hear? What's happening around us. Just that type of an experience occasionally can be wonderful. Another one I really like is moving then to the experience of the body. And this is again where those children who are quick to tears or anger or frustration, if we can get them to check in, to do a body scan, to take those deep breaths, that often is a real down regulator when it comes to anxiety. One of my favorite practices, and one that you can do anywhere, anytime, is the 4-7-8 breath. And if you've not done this before, I encourage you to search it, but the 4-7-8 breath, and I'd like you to try this with me as well. So begin by just getting settled, sitting up, and I'd like you to breathe in through your nose for a count of 4, hold it for a count of 7, and we're going to breathe out for a count of 8. So breathing in, hold, and breathing out. One more time, breathing in, hold, and breathing out. Right? Only later do we really begin to get to that attention to the mind kind of thing. So again, with young children in particular, or elementary age, checking in with their body, doing a body scan, taking some breaths can be a really powerful solution in those kinds of situations. I'd also like to share with you a couple of other things, because these are sometimes, again, surprising. So with an anxious kid, don't ignore that low level negative attention. And I think you're talking about that too a little bit when they start to get angry or upset. We don't want to ignore that and hope that goes away. Instead, we really want to actively engage them, anticipate that there might be difficulty. So we're actively engaging at the beginning of the class. Hey, I can't wait to see what you think of this. I'm going to check back with you in about 5 minutes, right? Walking away or moving on, and then actually checking back in 5 minutes. That very proactive strategy really can pay dividends for a kid who's just starting to amp up a little bit. I think another one is not publicly praising the positive behavior of an anxious child, right? Again, very often we're like, oh, you're doing such a nice job. Well, sometimes that will amp up anxiety. So again, that nonverbal private praise, your little signal between you. I see what you're doing there. I like that. A nod, a smile, a thumbs up, a wink. That there again, we have that connection, that acknowledgement, without calling the child out publicly when they can become rather anxious. If you have a kid who needs a break, again, how do we do that break, right? Do we just let them walk away and stew in their own juices and maybe not come down? Or can we do something that pairs that with a cognitive distraction? These are just a couple of examples, but it's impossible to read out loud if you're, for example, reading out loud for a younger child, or singing, or doing some trivia or a puzzle. It's impossible to do those kinds of things and think another thought like that internal negative ruminative thought that sometimes happens. So getting creative with that, I can see this child needs a break. I'm going to give them something that allows them to it's a simple task. It's something that they can easily do, but it doesn't allow them to just kind of sit and spin in their own feelings.
Yeah.
Right.
Yeah, that's important. Definitely. I've seen that to be very beneficial with the kids that I work with.
Wonderful.
Like, or even have, when they're doing something physical, they are reciting a poem or singing a song or something like that. It's been helpful.
I love
it. We have more questions coming in.
Wonderful. So let's go ahead and jump into those.
Here's another one that, I've seen this myself. My daughter tends to shut down when she makes mistakes. Mm-hmm. It's like I can't comfort her through words. She gets so caught up in doing things exactly right. Any suggestions for helping her to keep moving forward?
Yes, I love that. So again, my answer often depends on the age of the child in terms of what I might recommend. And we don't have that information here, but let me just talk a little bit about kind of the underlying things that I think that I'm hearing with that. You have a child who shuts down. And I think what was the terminology that was used? I can't talk them out of it.
Yep, she doesn't have the words or find anything. Comforting words don't work.
Right.
They don't get through. So
right. Yeah. So what do we do?
She wants to be perfect, right?
Yes, right. So there again, we have that stinking thinking that, that sense of perfection is the one and only thing, right? But I want to talk about two things. Number one, that's a child who I think would really benefits from some work on, developing a growth mindset, and not in that moment though. Like she said, the comforting words are, reasoning, explanation is not going to work when they're in that moment. So that's going to come before this ever happens, and it's also going to come later on. But when a child is just, I call it imploding, right? They're just shutting down because they're feeling so overwhelmed by it. Again, I want to talk to the feeling underneath. And when I say talk in this situation, I actually mean at a physiological level. Right? So when a child, whether they're having an extreme outburst or whether they're having extreme, I don't know, inburst, is that a thing? Words are throwing gasoline on a fire. And really think about that. If you kind of go back to those situations that went sideways, I would bet more times than not, it was because you were trying to talk to this feeling rather than supporting this feeling. So again, this is a kid who's I want to name what they're feeling, name it to tame it, right? So name what they're feeling. Whew, I can see that you're frustrated. And sometimes I'm not going to try to make that better. I'm just going to sit with them for a moment. The power of time and space is exceptional. Right? I can just sit with you in this moment. I don't have to do anything. I don't have to fix it. I don't have to make it better. I don't have to talk you out of it. I can just sit with you in it in an empathic way. And then when you're ready, we'll move on. And we don't have to discuss it again. We don't have to go back and discuss it again, right? And maybe I'll even praise that child later on. I really like how you handled yourself there. I could see you were frustrated, and I saw, what worked. And maybe later on you asked that question, what did you do to make yourself feel better? Surprising to me how little we ask children that question, because they do have these internal resources. And sometimes the things that they will tell us are things that we as an adult would never think of. But once again, what helps? And it's not just escape and avoiding the situation, right? But it can be as simple as getting a drink of water,
right?
Or petting the dog, or walking outside for a moment. And sometimes, of course, for a child with dyslexia, it's also like, let's really break this down. Let's see where the challenges are, and let me support you step by step.
Right. Great. So this is from somebody that is just, I think they just want overall strategies that, what overall strategies should kids be taught to deal with their anxiety while at school?
Mm-hmm.
And I know you've talked about a lot about different tools that they can use. But I like when you talked about them. Like, I think teaching mindfulness is really important, and I've seen that benefit the kids that I work with. But I'll let you elaborate on that question.
Yeah, sure. I love that idea. So first, can I just let me talk about some practical strategies?
Yeah.
Because I think that some of the practical strategies, whether this is schooling at home or whether this is, in the school setting, that there are some things that for kids who learn a little bit differently are important that we acknowledge. Right. So if your child has, first some general considerations, making sure, do they have enough space to work? If they're at home, is there a large, if it's possible, a large screen area for their learning? Do they have decent internet connectivity? These are sources of stress, quite honestly, for kids. Making sure that they have breaks between classes, making sure they have a designated area that they're working from, making sure that there's somebody nearby, if possible, to support them, making sure they get outside for part of their day. These are just simple strategies when we talk about managing anxiety at school, that we really want to make sure we're addressing.
And I think, can I just say, I was just
please.
thinking that as parents, it's really important to advocate for those strategies that they're implemented in the school setting. So I don't assume that they're always going to happen. So, advocate, talk to the teachers, and that teachers have really good intentions. They just might need to have that sit down with you and have that discussion.
Yes, absolutely. I think that, so just recognize is, this list that I'm showing you right now, are these areas where your child struggles? Do they have some difficulty remaining seated? Well, there's strategies for that. There's accommodations for that. Are they having trouble paying attention? Well, there's some strategies there that can easily, informally be implemented in the school setting. Do they get a little anxious around others, or do they get that performance anxiety, when they're asked to called on to answer, for example? Well, there's some really great, easy strategies for addressing that, priming them. If they seem bored, if they seem to have trouble getting motivated. So, if anybody's interested after the talk, I can send you a whole list of resources that are specific to that kind of thing. But in terms of that broader consideration for, how do we work with a child who has some anxiety in the school setting? I want to come back to teaching and modeling. Teaching and modeling. So teach new skills. Things like mindfulness can be tremendous. Now, that is, there's all kinds of ways to get involved in that. There's mindfulschools.org is one of my favorite resources, both for educators and parents and children, to understand what mindfulness is and what its potential is. If you go to mindfulschools.org, you'll find there a number of introductory lessons that as a teacher you can offer depending on the grade level of for children. There's some really great videos that introduce what the experience is, and some guided practices as well. So that, I think, is an important piece. Now, some people say, well, mindfulness isn't really for me. I think mindfulness is not just, sitting in this Zen-like posture. It is, again, finding ways throughout your day to check in, to connect with yourself, to connect with others, right? So that, I think, is an important piece as well. Some individuals with anxiety, I want to make sure that I mention this, it's important to really get some professional help. And for anxiety in particular, there's a therapy called cognitive behavioral therapy and mindfulness-based therapies that really help teach strategies to combat the thinking thinking that can be self-defeating or causing anxious behavior, as well as other healthy strategies for well-being. I think too, I don't want to forget the importance of doing things for others, right? I think we often, when we're anxious, we get very self-focused. right? Our own experience. And the research is very clear that number one, there's a lot of help for anxiety. Like, we've got that pretty dialed in. We can make a pretty significant difference in probably 85% of cases. We can really move the dial on anxious behavior in children. But also just finding things in your day-to-day life, things that you can do for others, small acts of kindness, practicing gratitude. Sometimes you have to dig deep for this one, but really recognizing and being grateful for all the things you have that are going well in your world. I talk to families and children about, how are you going to change the ending of the story that you find yourself in, right? So if your life right now was a story and you're telling that story, how do you want that story to end, right? And very often there's an aha moment there. This is really what I want as an outcome of all this. And then you're much more motivated to seek whatever help you need to get there. And again, asking for help if you need it. So I know that isn't specific enough, for one child, one situation, that answer, but I hope it gives a framework, again, reframing what we're experiencing to really help understand the child's behavior and know what we know and what we don't know to improve their situation.
Dr. Wingers, we have a question that you touched on a little bit, and it's something that I see a lot, and I think it'd be great for you if you have a moment to talk about. Sure. Is there a connection between anxiety and executive function?
Oh, absolutely. What an excellent question, right? Yeah. Another day, we could absolutely dive deep into attention and executive function issues and the link with different learning differences, because I think it's fascinating. I'm a big geek when it comes to that kind of thing. But I think, yes, to answer the question, there is a link. And both at the network level, the networks and circuits involved in the brain that impact executive functioning are the same networks impacted in anxiety in many cases, right? But I also think that if we're treating and addressing the executive function issue, we often ease the anxiety, okay? So it's not that the two always go hand in hand. They can, but they don't always. And what I find to be the difference maker in whether anxiety is also present along with an executive function issue is a couple of things. How well is that executive function issue understood by the people in that child's life? How well is it managed, treated, supported, right? Mm-hmm. And then what is the mindset that child or the people in that child's life have about that? Because the factors that impact success for folks with dyslexia, as you well know, are having strong support, right? Having that mindset that mistakes are opportunities for learning. They are temporary, they're not global, they don't reflect on me as a person, but more as a skill building opportunity. So I think that's the important piece to take away from that.
Right, absolutely. Well, thank you, Dr. Wingers, so much for the time that you spent with us and just bringing more awareness to the link with dyslexia and anxiety, and giving us some skills and some tools to use with our children in the classroom and our children at home. So thank you so much. But everybody out there, don't leave, because we have some giveaways that I look forward to sharing with you. So I'm going to share my screen.
Wonderful.
There we go. And so we have thank you right here. Okay, you guys. So here, everybody, this is an active activity. So get ready, get your fingers ready to type. The first person to type their name in the Q&A wins an AZIDA membership. The first person to type their name. Let's see who it is. And let's see, Mary, I cannot see who it is. Oh, no. Oh, okay. It is Karen Pack. Karen is a colleague of mine. Hey, Karen, high five. Awesome. Awesome job. Okay. So here is your second question. The first person to answer this question correctly in the Q&A wins a Starbucks gift card. Who hasn't already won, okay? For children with anxiety, what type of attention is easier to get and easier to understand? Is it negative attention or oh, somebody already got it. Awesome. So it is, the winner is Jen Woodward. Jen Woodward, congratulations. Awesome. Okay,
That's
you guys,
great.
let's do another one. Here's another one. So the second person to answer this question correctly in the Q&A is going to win a foundation scholarship, and you get to pick your level. It's level K, 1 or 2, okay? Name one of the 4 predictable anxiety triggers that Dr. Wingers discussed. Oh, Lori Martin is our winner. Lori Martin put down writing. Good job. Writing was one of the answers. So we have unstructured time, transitions, writing time, and unexpected change. Lori Martin is the winner of that one.
Great.
Okay, here's the next question. The third person to answer this next question correctly wins another scholarship to another Foundations workshop of your choice, either K, 1 or 2. Okay, here it goes. Is it good practice to publicly praise an anxious student? Oh, here they come. They're coming in fast. And it looks like Diana Woods. Diana Woods was our first person to answer that one. Congratulations, Diana Woods. Okay, so we have another question here. The fourth person to answer this question correctly wins a State 48 shirt. If an anxious student needs a break, what should you pair the break with? Oh, Katie Freudenberg. Hi, Katie. Katie was a physical activity, an activity. Katie Freudenberg wins. Okay. All right, you guys, I'm going to share my screen so you can see our next coffee chat, what it's about. Let me go back to that screen. So thank you again, Dr. Wingers, for spending your morning with us and spreading light on anxiety and dyslexia.
Such a pleasure.
Our next coffee chat coming up will be with Heather Casca and Dr. Anna Sosa, board members, both speech and language pathologists. They're going to talk about the connection of speech and language to dyslexia. So stay tuned for the dates on that chat. And we look forward to seeing everybody. And thank you again for sharing your Saturday morning with us.
Great to be with you all.
Yeah, thank you.
Take care.
Bye-bye.